This is just a reminder that if there's something that interests you in nursing, go for it. Do not let anybody discourage you or kill your dreams. I always knew that I wanted to be an ICU nurse, and I had a professor that told me she doesn't think that anybody should go into ICU. She told me that she thinks everybody should start in med-surg, build their skills, really learn how to be a nurse, and then make their way to critical care. Thankfully, I worked in the South. I pursued my dreams. In the South, they hire new grads directly into ICU. I know in other parts of the country that is not true. Having worked on multiple units at multiple hospitals, I've sat on some panel interviews when interviewing new candidates, and it's kind of hit or miss. Some places say that they love new grads because they can mold them into the nurse that they want them to be. It's easier to mold a new grad because they haven't learned bad habits throughout the hospital. And some places, they won't even consider you unless you've had 1 to 2 years working in another specialty. I think if you are able, go into what interests you. Don't waste your time doing something that you have absolutely no interest in, because truthfully, it's going to make you hate the profession. If you are able, try and get a patient care technician position while you're in school, and that is a foot in the door to the specialty that you want. When I was in nursing school, I held a position in the pediatric ICU as a patient care technician, and I also held a position as a nurse extern in the cardiothoracic surgery step-down unit. By holding that extern position, I was able to have early access to new grad residency interviews in the specialty that I ultimately went into. And this was the same for any other extern that was in the program. They got first pick of residency interviews before they opened it up to the general public. The things that you want to do are possible, and I'm saying this as somebody who was told not to go after my desired career path. And I just think back to where I would be had I listened to people who told me not to go after what it is that I wanted. Would I even still be a nurse right now? And the answer is no.